Everyone, welcome to the 11th webinar of this SCORA Idaho 2016 campaign. My name is Vivian and I am the SCORA Development Assistant. I'm very happy to be here with you guys. Today our webinar's topic is mental health of LGBTQ plus people, but we also have a little side surprise from our wonderful speakers from Taiwan with a little stories and experiences of the LGBTQ plus movement in Taiwan and its connection with the international movement. So before we start, I would like to introduce our two speakers. First of all, we have Dr. Xu, who is a psychiatrist from Taiwan. And then we have Jennifer Liu, who is a politician and activist from Taiwan. Both of our speakers work at the largest LGBTQ plus rights organization in Taiwan, which is the Taiwan Tongzhi Hotline Association, and they will have a lot to tell you. So, well, without further ado, let me just hand the time over to Dr. Xu.
Okay, thank you. And Vivian, thank you for your kind introduction. Can you hear me?
Yes, I can.
Okay. I'm Dr. Xu from Taiwan, and I will show my slides. And I'm a psychiatrist and child and adolescent psychiatrist in Taiwan, and Dr. Xu. And thank you for your invitation for this great speak in Idaho 2016. And the topic today I will discuss about is the mental health of LGBTQ plus people. Okay. And we all know that the diagnosis of homosexuality was removed from the DSM in 1973 and is now recognized as a non-pathological variant of human sexuality. And DSM is the Diagnostic and Statistic Manual of Psychiatric Illness from APA, which is American Psychiatric Association.
Excuse me, Dr. Xu, are you sharing your slides?
Yes, I've shown my slide.
We are not seeing.
Sorry, I will share
the
slide. Thank you. Wait a moment. Okay, can you see my slides?
Yes.
Yes.
Okay. I'll repeat again. And I'm Dr. Xu, psychiatrist and also a child and adolescent psychiatrist in Taiwan. And we know that the APA position statement about homosexuality and civil rights. In the context, whereas homosexuality implies no impairment in judgment, stability, reliability, or general social or vocational capabilities. The American Psychiatric Association supports and urges the enactment of civil rights legislation at a local, state, and federal level that would offer homosexual citizens the same protections. And that is the position statement about 40 to 50 years ago. And this statement was prepared by Robert Spitzer with the approval of the Task Force on Nomenclature and Statistics, and was recommended for approval by the Council and Profession and Association of APA. Who is Robert Spitzer? Robert Spitzer was chair of Task Force of DSM-3, which was released in 1980. And he was born in 1932 and passed away last year. But Robert Spitzer had some controversial issues event in 2001. In 2001, Dr. Spitzer delivered a controversial paper that can some gay men and lesbians change their sexual orientation? At a 2001 annual APA meeting, in that paper, Robert Spitzer argued that it is possible that some highly motivated individuals could successfully change their sexual orientation from homosexual to heterosexual. And the APA issued an official disavowal of Spitzer's paper, noting that it is not being peer-reviewed and stating that there is no published scientific evidence supporting this efficacy of reparative therapy as a treatment to change someone's sexual orientation. The reparative therapy is also called conversion therapy, which means that we change someone's sexual orientation intentionally. The paper has been criticized for its sampling methods and criteria for success for the reparative therapy successfully. In May 2012, Robert Spitzer said in a letter to Dr. Zucker. Dr. Zucker is the editor of Archives of Sexual Behaviors, and Robert Spitzer said that I believe at all the gay community and apology for my study making unproven claims of the efficacy of reparative therapy. I also apologize to any gay person who wasted time and energy undergoing some form of reparative therapy, because they believe I have proven that reparative therapy works with some highly motivated individuals. So now it is illegal for healthcare professionals in California to offer treatment to any sexual or gender minorities, with the aim of converting them from homosexuality, or at least reducing sexual desire. And now you can show the slides. Yes, about the Medscape Psychiatry and Mental Health. About this news. The law, which takes effect on January 1, 2013, and is the first of this kind in the United States, said that no mental health provider shall provide minors with therapy intended to change their sexual orientation. Now we know that lesbian, gay, bisexual, transgender, intersex, queer, and asexual populations are getting noticeable in recent years. However, in Taiwan, we still have some difficulties. We have a show like in local study in Taiwan that about 14% of Taiwanese college students were not absolutely heterosexual. The diagnosis of homosexuality was removed from the DSM, but we know that gender dysphoria is also under the process of being depathologized. And the sexual and gender minorities, such as LGBTQ, however, are still under depression, anxiety disorder, and substance disorders, substance abuse, and suicidality at a rate that have elevated in comparison with those in general population. And the risk has a significant association among anti-homosexual attitudes and the traditional perspectives of gender stereotyping, stigma, prejudice, discrimination, and poor mental health. So, since January 2015, that year, I started a specialized clinic for gender and sexual minorities in National Taiwan University Hospital. And the chief issues for counseling, including parent-child relational problems and the sequelae of coming out issues, are depressive and anxiety disorders, and substance-related disorders. And depressive disorders, okay, wait a moment. Okay, I should share the slides again. Yes, and suffering from HIV infection. And the stressors among HIV serodiscordant couples, which means that the couples including HIV positive and HIV negative couples, and the difficulties of identity and gender incongruence, and also sexual problems and other paraphilia. And that's the issues we should face in the specialized clinic for gender and sexual minorities in our hospital. And we can understand about the mental disorder in LGBTQ people from this systemic review papers in 2008. The data was meta-analysis and extracted from about 200,000 heterosexual and 11,000 non-heterosexual people. The meta-analysis revealed about twofold excess in suicide attempts in lesbian, gay, and bisexual people, and the lifetime prevalence of suicide attempt was especially high in gay and bisexual men, about 4 times. And we also know that the risk of depression and anxiety disorders over a period of past 12 months or a lifetime were about at least 1.5 times higher in lesbian, gay, and bisexual people. Also, in alcohol and other substance dependence over the past 12 months was also 1.5 times higher in LGBT people. And the results were similar in both sexes. The meta-analysis revealed that lesbian and bisexual women were particularly at risk of substance dependence. And the next topic I will talk about is about transgender people, and also in the psychiatric diagnosis, gender dysphoria. And this is the transgender pride flags. In transgender people, we should notice about the mental health and psychological interventions in the gender dysphoria diagnosis. I should clarify about definition. Transgender denotes the broad spectrum of individuals who identify their gender different from the assigned one. And some transgender people have a strong desire to be the other gender and met a diagnosis of gender dysphoria in DSM-5. They may change their sexual characteristics via hormone replacement therapy, which is acronymed by HRT, and sex reassignment surgery, or other cosmetic surgery. However, the policy in Taiwan have under debates. According to the Ministry of the Interior in Taiwan, there are 2 requirements for identity recognition of the gender. The first one is that the 2 psychiatrist certificates for gender dysphoria and the surgical removal of external and internal genital organ. And several non-government organizations of transgender rights opposed against the current policy due to a violation to the transgender people on the human rights, including the fertility and physical integrity and self-determination. Also, the World Professional Association for Transgender Health, WPATH, issued an identity recognition statement in 2010, revealed that the attitude that no person should have to undergo surgery or receive sterilization procedures as a condition of identity recognition. So the WPATH Board of Directors urges governments worldwide to eliminate the laws for identity recognition that requires surgical procedures, which we have worked on Taiwan's governments. And so the policy of gender identity recognition is mentioned above. We have psychological interventions, including the psychotherapy and parent counseling. Psychotherapy or counseling should give the secure of a positive self-image or dealing with negative reaction from others. That's the key points we should work through. And the parent counseling, we have several important issues that we should give the child or adults who are gender dysphoria about to their parents. The first one is finding a sensible middle of the road approach between an accepting and supportive attitude toward their child's gender dysphoria. And the second is to protecting their child against any negative reactions from others and remaining realistic about the actual situation. And the third is finding a right balance. The right balance is essential for parents and clinicians because gender variant children are highly vulnerable to developing a negative sense of self. The primary aim of our goal is for the child and family to function better. But the function better are very difficult for the family because everybody in this family, they have different goals. And many children with gender dysphoria can benefit from psychotherapy or counseling to aim at securing a positive self-image. And so that's what we should work through. On the other hand, we also have physical medical interventions to transgender people. And we have three parts of the physical medical intervention. The first one is completely reversible interventions, which means the puberty suppressors, such as gonadotropin releasing hormone agonists. And the second is the partially reversible interventions, which means cross-sex hormones. And the third is completely irreversible interventions, which means gender reassignment surgery. The first one, the puberty suppression, we should offer the adolescent or adult to smoothly explore his or her gender identity to find out if a gender reassignment trajectory is really what the youth wants. And their bodies in this stage will not continue to develop in an undesired direction because we give them suppressors such as GnRH agonist. And we also stop the development of secondary sex characteristics, making passing in the desired gender roles earlier than delaying treatment until adulthood. The decision to undergo gender reassignment should be taken in several steps. And the first one is the diagnostic phase, is to follow the real-life experience stage, in which cross-sex hormones are prescribed, and also eventually, the subject can undergo gender reassignment surgery. If the criteria are met, we also give gonadotropin releasing hormone agonist to suppress puberty and prescribe when the youth have reached about teenage stage 2 or 3 of puberty. And the second part is the cross-sex hormones. Cross-sex hormones will result in a start of puberty of the desired gender, which means that, for example, male to female or trans girls receive estrogens, will result in breast growth and female fat distribution. And female to males, which means the trans boy, receive androgens and will become more muscular and develop a low voice and facial and body health growth. And the third part is completely irreversible interventions, which means the gender reassignment surgery. And this physical medical interventions is from the international standards of care of WPATH, which was released in 2011. The next part I will discuss about is the HIV and related mental problems. HIV and related mental problems we should mention in the first place is mood disorders. And mood disorders, particularly depression, are the most common psychiatric complication associated with HIV disease. And the lifetime prevalence of depressive disorder in HIV-positive individuals about range as high as 22%. And lifetime estimates of about 5% to 17%, and also current major depression diagnosis is only about 3 to 10% in the general population, which means that HIV positive persons have higher percent of mood disorders. And we also should care about the neuropsychological disorders, because HIV-related clinical and neuropsychological disorders are more common in drug abusers than among other populations. The neurocognitive disorders are most common in late-stage HIV disease, which means the AIDS. And in this population, anxiety disorders frequently seen just after HIV diagnosis, and the depressive disorders are frequently seen when HIV-related symptoms appear. So the anxiety spectrum and also depressive spectrum that we should notice about. Also, HIV-associated dementia is that we should follow up. Because with heart, the incidence of HAD has fallen. But although its prevalence has actually increased, because HIV-positive people are living longer, and HAD affects about 10 to 20% of people living with HIV. Why HIV-associated dementia, HAD, appear? HAD's exact causes are still unclear, because most closely to inflammation in the brain rather than with viral load or HIV encephalitis that we discuss in the current paper in journals. But neuroinflammation has long been recognized as a common pathological findings in HIV-positive individuals and has been linked with CNS dysfunction. And the final part I should mention about is the practice principles. I have mentioned about several parts of mental disorders that we should care about in LGBTQ persons. And I cited the practice parameter on LGBT and also the gender nonconformity and gender discordance in children and adolescents. This review article is from the Journal of American Academy of Child and Adolescent Psychiatry in 2012. They have 9 principles. The first principle is we should have comprehensive diagnostic evaluation. And this diagnostic evaluation should include about an age-appropriate assessment of psychosexual development of all youth. And we should know that the developmental trajectory of children and adolescents, and we can give the appropriate and also adequate suggestions to them and their parents. The second principle is that the need of confidentiality in the clinical alliance is a special consideration in the assessment of sexual and gender minority youth, because they may have many secrets in the different stages of their coming out process. So we should give the adequate confidentiality in the clinical situation. The principle 3, that the family dynamic pertinent to sexual orientation, gender nonconformity, and gender identity should be explored in the context of the cultural values of youth, family, and community. Because we know that different cultural values affect about the coming out issues and also the stressors to the sexual orientation or the different sexual orientation and gender nonconformity people. For example, in Taiwan, the traditional attitudes about having offspring is a very important issue in our families. But maybe in the US, the Christian belief is also another important issue in their family dynamics. And the principle 4, the clinician should inquire about circumstances commonly encountered by youth with sexual and gender minority status that confirm increased psychiatric risk. And the psychiatric risk I have mentioned above is about bullying and suicide and high-risk behaviors such about impulsivities and substance abuse and also HIV-related or some sexual transmitted illness-related mental health problems. And the principle 5, the clinician should aim to foster healthy psychosexual developments in sexual and gender minority youth and to protect individuals' full capacity for integrated identity formation and adaptive functioning. And the principle 6, the clinician should be aware that there's no evidence that sexual orientation can be altered through therapy, and that attempts to do so may be harmful. And I have mentioned above too that reparative therapy or conversion therapy is now prohibited in some states in the United States. And principle 7, clinicians should be aware of current evidence on the natural course of gender discordance and associated psychopathology in children and adolescents in choosing the treatment goals and modality. So we should be aware about the different kinds of needs of the gender discordant children or adolescents that can give appropriate suggestions. Principle 8, clinicians should be prepared to consult and act as a liaison with schools, community agencies, and other healthcare providers. We should advocate for the unique needs of sexual and gender minority youth and their families, which I will mention in the following slides, that we can do more things to the community and also to the society that can help the gender or sexual minorities people. The principle 9, mental health professions should be aware of community and professional resources relevant to sexual and gender minority youth. what we have done in Taiwan, we have held LGBTQ workshop for SCORA in Taiwan every year in the just before the LGBT Pride Parade in October every year. And also we have seminars, that is mental health and sexual gender minorities. And the seminars we held, we recruited to the psychologists, and also social workers and school teachers and nurses, that we can promote more information about mental health of LGBTQ plus people. We also promote about all gender restroom, and this is the photos in the National Taiwan University Hospital. That is all gender restroom. We also promote about this gender-friendly restrooms in every schools and hospitals in Taiwan. And we also support equal rights of marriage. And this is the petition that psychiatrists to promote that the equal rights of marriage in Taiwan in 2013. And that we have worked through, but there are still lots of work we should do in the future. And now is what we can work together and also to promote LGBTQ equality in Taiwan and also throughout the world. And this is my presentation, and thanks for your attention. And also now it's your turn, Jennifer.
Okay. Thank you, Dr. Xu, for this first part of your wonderful and professional presentation. I just want to quickly remind everyone that you can post questions anytime using the Q&A function that I'm sure all of you are familiar with now, or either leave comments under the YouTube video, and I'll be checking them and asking them in the end of this webinar. So now I would like to give the time to Jennifer.
Hello, everybody. I'm Jennifer Liu. I'm from Taiwan. And thanks to Dr. Xu, his professional presentation. And in the next, I will give you some brief concept and history of Taiwan LGBTQ plus movement. Actually, in Taiwan, we don't usually use LGBTQ plus. Yeah, we usually talk about LGBTI movement, but it's all similar. So I think you know that is all similar. Okay, I will focus on the movement and some progress happens in Taiwan recently, and I'm looking forward to more interaction and questions later on. And here, let me check my PowerPoint first. Okay. So wait a second. Let me try to do this. Yep. Is that right?
Yes.
Okay.
I can see your slides.
Okay, cool. I think all of you might know where is Taiwan here. So I think I should mention that in when I talk about the Taiwan LGBTI movement, because I think we kind of have the most progressive LGBTI movement in Taiwan within the Asia region, is because we have our system. And maybe some of you know that Taiwan just went through a huge political change. Recently, we have our first female president, and the first time DPP is in the past they are our major opposed political party, but now they are kind of our biggest political party right now. DPP become the biggest party in the Congress, and it's the very first time in Taiwan's history. Of course, LGBTI rights have more allies in the Congress right now. In the past, lots of policy and laws about LGBTIQ people, it's really hard to push in the past, but right now we have more friends in the Congress. So after actually, Dr. Xi and I, we have been working together in Taiwan Tongzhi Hotline, I think for maybe 12 or 13 years. So when we were in our college time, we start engage into the LGBTI movement. And right now, after 13 years of engagement in LGBTI movement and the training in Hotline, I think I decided to further promote the equal rights of LGBT individuals by participating in the local election. So last year, I was the candidate. I was running the office for national legislator election in Taiwan, and I think and my party, Social Democratic Party and Green Party's alliance, we do have 5 out LGBT candidates in Taiwan, and that was the first time we have so many openly gay candidates historically. So I want to mention that Asia is the largest and most culturally and political diversified continent. So I think that making it very complex environment for the LGBT movement. So because Taiwan underwent some political changes recently and began more open, and we do have more room for LGBT rights recently, but since 1990s and going along with our democratic movement, we do have lots of progress. However, we found that we were not be able to move forward on the certain issues politically and legally because of the major of our Congress in the past was very conservative. So here is some brief background for you. Many different nations, they do have same-sex behavior criminalized, but in Taiwan we don't have that kind of policy, and same-sex behavior is not a crime in Taiwan, but LGBTQ community have been ignored and oppressed by society. For example, one of my I have a friend who is very open and totally out in the States, and he have been living in the States for a really long time, and he is a Taiwanese. When he came back to Taiwan with his family, he never mentioned about his sexual orientation, but he do bring his like partner with him back to Taiwan and join the family events, blah blah blah. But they never mention that. And it's a very common situation in Taiwan actually. So also our press media and public media they in the past we have a lot of stigma and negative images in the past, especially for it's really bad for our LGBT youth, and they didn't have enough like resources in the past. But that's also the one of the reason I want to join Hotline, Taiwan Tongzhi Hotline, because we do creating lots of different resources for, especially for the youth, LGBT youth in the campus, and also for when they face some difficulty in the families. And here is some significant milestones, and I want to mention that the third one in 2004. The legislation.
Sorry, Jennifer.
Yep.
I think we're not being able to see the slides right now. Do you think you can try putting it in full screen?
Let me see. So can you see me?
No.
No. Okay. How about that?
Okay, now we can see you.
Can you see me? Yes. Okay.
Yeah.
Let me try it again. Is that okay?
Right now I can see, but I'm not sure if the participants can, so if anyone who still can't see the slides, please just notify us.
Yeah, please let me know. I just want to highlight that we do have a very progressive act as a very good policies about gender equity education law. Actually, in my perspective, I think we now have the most progressive environment for LGBTQ plus people in Taiwan.
Excuse me, Jennifer. Excuse me,
Yeah,
Jennifer, and I cannot
yeah.
see your slides on the
Okay.
screen.
So how about let me see.
Yes,
Is that
now I
okay?
can see your slide. But Vivian, can you see the slide?
Yes, I can see the slides.
Okay.
它可以用
Okay.
播放。
但播放 if the turn on you just cannot see that. So is that okay?
Okay.
If it's okay,
I can see it
go
right now.
that way. Okay.
Yes, I can see right now.
Okay, so I think the this law have been making huge changes in Taiwan for at least 10 years, for the decade. In the past, when in like 10 years ago, 10 or 12 years ago, people usually don't understand what is LGBTIQ people. Not mention that we have this kind of like lecture or small talk in the campus. But right now, for example, like Taiwan Hotline, we can have more 500 speeches every year from elementary school to college, and we do impact a lot of students, and we can see the huge difference that is. You can see in the past, uh, uh, we don't have so many people who support marriage equality. Like 10 years ago, about 20% people who say they support marriage equality. But right now, on average, is like 54%. And in terms of 20th generation, so you can see that is 84.1% support marriage equality. And so in 10 years ago, so this 20th generation, 10 years ago, they are in their elementary or junior high school. So after they do go through the gender equity education process, and right now in their 20s, they totally feel like they totally okay with LGBT, and they do support their friends and family. And I think that acted making a huge difference in Taiwan. But also, of course, we do have facing some difficulty and challenges, especially when we have our marriage equality bill and civil partnership rights bill in 2013. I can show this. Can you see that? Yeah?
Yes.
Okay. Yes, okay. Those people, they are march for against marriage equality. They the banner they handed up say Taiwan's hope is next generation, and something like European human rights core already passed the marriage equality is not human rights. So in Taiwan, we also face the same situation with like in Europe and in the States. We have really huge anti-gay power these years, and we are still learning how to deal with it. And because we in the past we don't really understand the whole church, conservative Christian church system. So so I think we are still learning how to deal with it, and especially in the political area. So the photo you see right now is the people who wear the masks as the people who against the LGBTI people. So in the middle, there's the guy. He handed up the banner says, "I respect heterosexual people," and I think what he wants to say is, the only thing we want is people respect LGBTI people. That's only what we want. Yes. Okay. And the next, so the current state, that will my last slide, because many people, especially internationally, lots of my international friends, they always think about, oh, if Taiwan will be the first marriage equality nation in Asia, or oh, I thought you all already have the marriage equality bill already passed or something like that. But actually, the marriage equality bill right now, we still have a long way to go. And also in the bill, and also in the gender education area, we all facing a very strong against the power. And the Dr. Xi talks about the trans community and HIV community, so I won't mention that a lot here. But I think we do because we do have a new president, and also we have a new Congress right now. So I'm very, I don't know, positive about the future of Taiwan LGBT rights. But however, I'm also worried about people think we almost there. So so let's just wait. We don't have to do more or something like that. So so that's yeah. So that's what I think about the issue. So I will looking forward for more questions or discussion later on. Thank you.
Thank you so much, Jennifer. And I have received two questions so far. They're not in the question part, but I will read them out to you. Okay, so the first question is for both speakers. There are current efforts of eradicating pathologization of the trans population by taking gender dysphoria off the DSM. What has been the discussion in Taiwan?
Okay, and I think I can answer first. Okay, yes, there's really many debates in Taiwan about trans people about the diagnosis of gender dysphoria, because we know that gender dysphoria is. Can you hear me? Yes. Okay. Because the diagnosis has been undergo a depathologized process in DSM, because we have eliminated the term disorder from gender identity disorder to gender dysphoria, and we look forward to the more the disease process in the future. But there are some debates because the national health insurance, I think they want more resources from national health insurance because the burden of the economy, the burden of the money they should spend in sex reassignment surgery is so high. Not every transgender people can afford, so they want to have the insurance paid. But the difficulties and controversy in Taiwan now is that they are in the DSM. They have this disorder, have this diagnosis, but they still cannot get the payment from the national health insurance. So they want to get more insurance paid from our insurance system, but they also want to eliminate this diagnosis. I think this is the most debates in our communities.
Okay, I will share the different point of view about like from the movement side. I think one of the problem of the trans issues have lots of debate in Taiwan because I think in the past we don't have enough safe space and platform for transgender people, and also because lots of trans people they are struggling with their gender identity and their job, their schools, and also with family. They have less. I think they have less like 动力要怎么说？
Motivation or
Motivation, yeah. They have less motivation to join a group or join a like public discussion community in Taiwan in the past. But the Hotline, we have been working on trying to build a trans community for them, and also make sure that different trans issues can be equally treated in that group, in that trans working group. And so right now we are building the trans communities base to understand more about issues and collect different ideas and opinions in the community. So I think we, in terms of that questions, I think in my perspective, I think we need more discussion in the trans community, and also need to engage more trans people as well.
Okay, thank you for such wonderful answers. And the next question is specifically for Jennifer. This person asks, what are the strategies that we can use to motivate the LGBT population to become lawmakers and representatives like yourself?
It's a huge question, but the first thing I want to say is, don't make your goal so big. You can start with because I'm not thinking about joining the political area or running for the campaign like 10 years ago. That's not my goal. In the past, the only thing I want to do is try to help people like me, and try to help people like me when I was a teenager. That's why I joined Hotline. But when I joined Hotline, I realized that lots of different difficulties and also lots of tough situation is all relate to our policy and political area. Yeah, that is so that I went through like 13 years. Then I realized that if I can be that person who can go into the system and trying to change something, and then the future might be better. So that's the reason. But I think everyone has his or her own perfect position. So I think the most important thing is you can find your perfect position. Like Dr. Xi, he is the perfect position for him is in his professional area. Maybe it's not that good to him that go into the campaign or something like that. So I think the most important thing is finding something you like and the perfect for you. Yeah.
Okay, I've received several more questions. The next one is, Are there any efforts from the government to increase education on gender identity or sexual orientation issues in public schools or other academic scenarios?
I think there are some movements or some policies that our government has done, but of course, we think that that's not enough in the past years. We have some gender education laws in our junior high school. So we can have speeches, can give a talk presentation in our junior high school and also our senior high school. And there are many hours in a semester, so we can give some all gender education or some LGBTQ speeches. But there are
let me add one thing. That's compulsory, and then the policy says that every student from elementary school to senior high school, they have to take at least 4 hours gender education classes per semester. But you know, gender education is a very broad definition. So if you can say the how to date with a heterosexual person, there is also gender education. So it depends. It depends the teachers' ideas. Sorry.
And we also see some anti-homosexual or anti-transgender people, such as some churches. They also give gender education in elementary schools. But the attitudes that we think that is harmful to the elementary school students.
It's a gender education.
Also gender education. So I think we have a long way or more. We can give more efforts to our gender education, not only in our elementary school, junior high school, and also in our medical school. I think it's important because there are few courses in our medical schools to teach about the gender education and also sexual and gender minorities. I think it's a pity that we don't have such more courses for this. So we should promote about this continuing education also in hospital.
Yes, I agree with Dr. Shi because I'm a social worker. In the past we don't have this kind of like multicultural or multi-gender lessons or class before because they don't have this kind of broader ideas when talking about the curriculum. But I'm looking for in the future that because no matter doctors, nurses, or social workers, we working with people. So we have to understand different kinds of people. So we can trying to find a good way to fit every different kinds of our clients, our patients, something like that. Yeah.
Okay, before we move on to the next question, I would like to add a little bit from the perspective of a student that grew up in this gender equity law, that I feel like when growing up, I know that even under this law, the quality of the education might not be as we desire it to be, but at least in the process of growing up through elementary school and junior high school, the conversation and discussion was always open, and I was brought to this issue from very early on, and I think that is a success that our education has achieved. But I do understand that even though there are a lot, like seriously, a lot of gender issue student clubs in universities, we do not have a lot of that in the standard curriculum, especially in medical schools. Like we have FMS Taiwan, who talks about does a lot on this. We have like student organizations everywhere, but in the curriculum itself, it's still lacking. So I think that's something that we might be able to work on. And so I have another question. This is from a fellow medical student from Taiwan. He said that as a college student in Taiwan, there are many situations where we think that cross-dressing, especially when men are wearing female clothes, are funny, and I know that a lot of student activity use it as a form of entertainment. And what are your opinions on this? For example, it's mostly used as a entertainment for the audience rather than the expression of the people themselves. So what are your opinions on this?
Okay, Jennifer?
Stone, paper, scissors. I can, it's difficult to share my ideas in English in these questions, but I will try my best at that. Taiwan, many people think Taiwan is a like very gender equal or progressive country, but actually we do still have a lot of discrimination in sexual and gender way. Like people always laughing at like sissy boy, or we all laugh at our president Ma that if he has pussy or not, something like that. So gender issue is one of the most like popular topic when we want to laugh at someone, and actually I think we have to increase and improve more equality ideas when we were very young. I mean, we should teach our children, especially from kindergarten or elementary school, that it's not acceptable that you laugh at someone about his or her like gender appearance. Or we need to talk about the difference or diversity from the appearance to the gender identity or sexual orientation to our children, especially from kindergarten students, because they start this kind of like pattern when they were very young, and when they once learned, it's more tough to make them change. So I think the education is still one of the most important area I want to improve in Taiwan.
Okay.
Yes.
And I think the cross-dressing as an entertainment, there is long history of entertainment as cross-dressing in our college camps or in even in our junior high schools. And I think the problem is not cross-dressing itself. The problem is our attitudes to face this kind of entertainment, because we still have the binary system about sex or gender. So we think that cross-dressing is funny or hilarious. But if everyone can play cross-dressing, everyone can try the cross-dressing as their part of their lives, and everyone can break the gender role in our society, I think we can have more power in our binary sex system. And I think this is a reverse. This is a reverse to our binary system of sex. And this is another perspective to our LGBT movement. But it's hard. I think it's hard. But I think it's another way we can try.
Okay, thank you. Also, we are running out of a bit of time, but I do still have received another question. So, does legislation in Taiwan for intersex people force them to choose a specific gender, or do they let the individual identify later? And Is there any specific laws on this?
In terms of law, I can answer the law, and Dr. Shi can answer the reality. In terms of law, we don't have this kind of specific law. And intersex, I think every time I talk about intersex, I do apologize that we don't have we didn't have lots of and enough discussion about intersex in Taiwan. I think the reason is there's still fewer intersex people are willing to, or willing to like come out and trying to increase the public education or discussion. I think we only have one intersex activist in Taiwan, and he said to me about how difficult and how frustrated he has been searching for the people like him, but failed again and again every year. So I think that is our next goal, to achieve that, to like trying to empower or engage more intersex people in Taiwan, so we can build that discussion in the future.
Yes, and also in the medical situation, that some intersex people who are born to be found that they are intersex, they may be determined about their sex from the chromosome typing, and we know that the chromosome typing then determine the sex. But I think intersex issues are more complicated, not only the chromosome typing. So many intersex people, when they grow up and they don't know they are intersex, and they may find that they are intersex from some incidental situation, such as the transsex process, because they went to our clinics and we have some suggestions that we think that they should get the chromosome typing, and they found that they are intersex, but they don't know before. So it's more difficult in this age, as they are adult, to change their sex or to determine their sex. And I think intersex is not only medical issues, but also social issues, because they have to determine their social gender. That is not really workable, because I think that they may not have to determine their gender roles in our society. They can have some spectrum, they can have some fluid in their gender choice. I think that is more broader way. It's a broader way for them to have more freedom in our society, and also their gender roles.
Sorry, I want to add one thing, that actually, based on my India transgender friends, when they came to Taiwan to participate our Yoga Asia, as about Asia LGBT activist conference, and they say Taiwanese visa, we do have the gender about X on their visa, so and they don't have to decide male or female. They can use X on the Taiwan visa on their passport. So I was very impressed about that policy, and actually I didn't know that, because I don't need Taiwan visa for enter the country. So if anyone want to enter the country by our visa, you can try if you can get X.
Okay, wonderful. So right now we have no more questions, but I want to remind everyone that you can post questions even after the webinar, and I will make sure to pass it on to our wonderful speakers, and they will try to answer them, and I will post them later. Before I hand it to Dr. Xu and Jennifer for final words, I just want to say that we're very, very grateful to have you guys here. And as a young person in Taiwan, I do believe that I do believe what Jennifer said. We are in many ways the most progressive on these issues in Asia. Obviously, we still have a lot to work on, but the reason that I was very happy to bring you guys to these webinars is that I hope this can provide experience and context for countries with a similar cultural background, because in many other ways our society is very conservative, but on this issue we can make progress. So I hope that provides a positive experience for for other neighboring countries. So do you guys have any words for our participants?
Okay. I really appreciate that you medical students can join these webinars, because I really think that the medical students are our hope in the future because we have suffered from many traditional attitudes and many conservative attitudes in our medical environments. But when every time I see the medical students and they are so liberal and they are expecting about more freedoms and more LGBTQ movements information, I think that we still have hope in our medical environments in the future. Really, thank you.
Okay, thank you for having me here. And I'm also, like Dr. Xi, I'm very happy to see next generation who are eager to understand more about these LGBT rights issues. And I think the future things everyone can do is you can impact one person in your life. You don't have to choose the difficult one like your parents, but you can choose like your classmate, your colleagues, your friends. Just impact one person, and I think one person can impact another person. So the whole society will become better and better in the future. So everyone is a very important key roles in your life, in your environment. So everyone is very important, not just like activists, something like that. We can do the same thing. Thank you.
Okay, thank you both, and thank you everyone for watching. So that's it. Goodbye.
Bye.